In an osteopathic treatment methodology, the body is divided into so many body areas and the physician is going to manipulate these body areas. Say for example, we have like the head and the spine region we can divide it into as a cervical, thoracic, lumbar, sacral plus a rib cage and the abdomen, chest and the viscera. Now you will have to select the code based on the region that is being manipulated. For example, a kid who is presenting with a shortness of breath or a cough problem, now the provider can very well manipulate the thoracic region or the back region, right? So in that case, you would have to report a code for osteopathic manipulative treatment 1 to 2 body areas, which are the areas that is treating. So the coding is pretty much straightforward. Coming to CMT, which is chiropractic manipulative therapy, here you should understand it is chiropractic. Chiro means hand, so the treatment is being directed by the hand, okay. This is a specialized form of physical therapy. That is why chiropractors are considered as primary healthcare providers. They are considered like doctors because the treatment that they render is a specialized form of manipulative treatment. Here again you should understand, you should know the areas. So primarily the CMT or the chiropractors treat the spinal regions. Say for example, for them any abnormality in the body is due to subluxation or due to dysfunction in the spinal joints. So they tend to rectify the misalignment or the malalignment of the spinal levels. So here again we have like the cervical, the thoracic, the lumbar and the sacral, and of course the extra spinal regions as well. Say if the provider is going to treat the shoulder joint, he is going to manipulate the shoulder joint, then you will have to report the code for CMT or the chiropractic manipulative treatment of extra spinal region. Here you should understand like manual therapy is bundled into the chiropractic manipulative treatment. For example, the patient is presenting with a lumbago and the chiropractor is determining that CMT should be done for the lumbar region as well as the sacral region. Okay, so here you should understand like he is also going to perform a manipulative treatment or the manual therapy of the lumbar region. Here the regions we have found out is lumbar and sacral. So you can report CPT 98940 for chiropractic treatment for 1 to 2 regions, spinal regions, right? So here you find like the manual therapy is also done in the same lumbar region. So you are not supposed to report 97140 separately because it is bundled with the lumbar region. In case a manipulative therapy or the manipulation therapy is done for some other region, say the shoulder joint, you can report that separately as 97140 59 and 98940.